Welcome back. In our previous video, we had a brief introduction to cervical cancer. But knowledge is just the first step. We need to arm ourselves with the tools of prevention. The first one being vaccination. Girls can start getting vaccinated from the age of 9 years. And up to the age of 15 years, you'll need just 2 doses. One at the time of visit and another one 6 to 12 months apart. But if you're late and you start your vaccination series only after the age of 15 years, you can get vaccinated up to the age of 26 years, but you would need 3 doses. One at the time of visit, 1 month later, and 6 months later. HPV is the kind of virus that has many subtypes, which is why there are many different types of vaccines available in India. Cervarix is one type that covers the 2 major cancer-causing subtypes of HPV. Gardasil is another one that covers, there are 2 types, that covers 4 subtypes and there's one that covers 9 subtypes. Visit your family doctor or gynecologist and find out which best suits you. We also do not recommend pregnant and lactating women getting vaccinated because there is limited information on the safety during pregnancy. If you're somebody who already has a pre-existing HPV disease, like a genital wart or a positive HPV lesion, you can still get vaccinated because you might not have been exposed to all subtypes of HPV. Men can also get vaccinated. This because it does not just prevent cervical cancer, it also prevents other diseases caused by HPV, such as anal cancers. Although vaccination is crucial to prevention, it does not negate the need for screening. Regular screening must be done. This brings us to the next part, screening. In India, we have 3 types of screening. Visual inspection with acetic acid. This is for low resource settings. It's easy, low cost and easily available. If you're in an urban setting with a little more resources, you might have access to pap smears and HPV DNA testing. Pap smears are where a brush is used to collect the cells from the cervix and then visualize them under the microscope. Contrary to popular belief, it's not too painful. It might be a little uncomfortable, but it's definitely worth it. The screening protocols, as per our country's recommendations, starts at 30 to 65 years and is recommended the frequency of 5 years. But if you have the resources, if you are in an urban setting, we recommend something more frequent. We recommend starting screening at the age of 21 years, getting a pap smear every 3 years. And once you've reached the age of 30, we recommend getting pap smears along with HPV testing every 5 years if you have access. If not, you can continue pap smears every 3 years until the age of 65. At 65 years of age, you can stop screening if you've had negative screens previously and if you're at low risk. If you're somebody who has HIV, you would start screening at the time of HIV diagnosis or at the onset of sexual intercourse, whichever occurs earlier. You would then have to get annually screened until you get 3 negative results. From then, you can continue the regular testing like other women. If you are immunocompromised, let's say taking immunosuppressant drugs for if you've had any transplant, you would also require annual screening at the onset of sexual intercourse with both pap smear and HPV testing. From awareness to action, the power to write cervical cancer's final chapter is in our hands. Let's turn the page on the chapter of cervical cancer together. We've linked the resources that we've used for this video below for further information. And if you have any questions, we're happy to answer them. Like, share and subscribe and stay tuned for more such videos. Thank you for your time.